Hey Cheryl, do you know what childhood aphasia is?
Childhood aphasia? I thought only adults could get aphasia.
So did I.
Maybe you should ask Dr. Beeson. She's the expert in aphasia.
That's a really good idea.
Aphasia is a language disorder that is characterized by damage to the left hemisphere of the brain, or the language center of the brain. It is not an impairment of intellect. Children can have aphasia in the same way that adults can have aphasia, but there really isn't much research on childhood aphasia.
Talking to Dr. Beeson was a good start, but to fully understand childhood aphasia, more research was needed. Older research states that children can have developmental aphasia, meaning that they can be born with this disorder. However, most new literature refers to childhood aphasia as an acquired impairment similar to adult aphasia. For the purposes of this video, I will be examining the causes, characteristics, and language implications for children with acquired aphasia. The most common cause of childhood aphasia is traumatic brain injury, or TBI. This occurs when the child's head is hit or shaken. Although TBI is the most common cause of aphasia in children, only about 19% of pediatric TBIs result in childhood aphasia. Strokes resulting in childhood aphasia can be caused by birth defects, infections, or blood disorders like sickle cell disease. Other causes of childhood aphasia include infectious diseases such as encephalitis or severe swelling of the brain, convulsive disorders such as Landau-Kleffner syndrome, or brain tumors, specifically on the left side of the brain. In the acute stages of brain injury resulting in aphasia, most children experience a brief period of mutism or silence. After this effect fades, a child affected by aphasia may have anomia or naming difficulties, problems with comprehending speech, and difficulty initiating or beginning to speak. They may also frequently exhibit semantic paraphasias such as saying the wrong word, phonemic paraphasias such as mixing up sounds in a word, dysarthria or imprecise speech, perseverations or repetitions of a familiar word or phrase, and difficulty with reading and writing. The symptoms of aphasia affect many aspects of language and communication in children. For one, most children with aphasia have non-fluent speech, meaning they struggle to get words out and speak in short phrases. They also often mix up words or sounds. Their inability to use full sentences with correct words greatly impacts communication with adults and peers because part of the message is lost. Children with aphasia also have trouble understanding what is said to them. Long-term language effects range from mild to severe, based on the size, location, and cause of damage to the brain. These persisting language problems may result in the child doing poorly in school or having difficulty socializing with peers. Children with TBI usually have the most full recovery in comparison with children who have aphasia due to Landau-Kleffner syndrome, stroke, or infectious disease. This is because damage from TBI is located in one single area of the brain as opposed to more widespread damage. Children's ability to regain language skills is greater than adults because they have greater neuroplasticity. This means that the functions of the brain are less set in stone because other parts of the brain can take on the responsibilities of the damaged areas. In children with aphasia, this means that other parts of the brain can learn the language functions. Speech-language pathologists teach children strategies to improve lexical retrieval or naming, grammar, listening skills such as those needed to follow directions, and interactions with family and peers. SLPs may also be responsible for teaching families strategies to effectively communicate with their child. Educating the family is an important part of therapy for children with aphasia because the process of regaining language and learning new language is difficult. A child with aphasia will benefit from having language skills reinforced at home and in daily life.